there, good evening and a warm welcome to the news live on Rupavahini ChannelEye. I'm Sharama Screeners.
A very good evening indeed. I'm Javed Bongzo and we begin with the headlines of tonight's news.
Travel restrictions for the entire country from 11 p.m. on the 21st till 4 a.m. 25th of this month. The second dose of the Covishield vaccine was given to 267,000 persons and the first dose of the Sinopharm vaccine to 375,000 persons. The target of making 10,000 beds in 10 days has been fulfilled. A survey says that the worldwide corona-related deaths has exceeded 6.9 million. The Supreme Court decision on the draft bill of the Colombo Port City Economic Commission will be presented to Parliament tomorrow.
Now for those and other stories in detail. Head of the National Operational Centre for the Prevention of COVID-19 Outbreak, Army Commander General Shavendra Silva, says that travel restrictions for the whole island will be reimposed at 11 p.m. on Friday, the 21st of this month to 4 a.m. on Tuesday, the 25th of this month. In a communique issued this afternoon by the head of the Operational Centre for the Prevention of COVID-19 Outbreak, Army Commander further says that the travel restrictions will be further reimposed again from 11 p.m. on the 25th of this month till 4 a.m. on the 28th of this month. Army Commander General Shavendra Silva said that travel restrictions will be imposed on the entire island from next Friday at 11 p.m. to 4 a.m. on Tuesday the 25th of this month. He adds that the travel restrictions will be reimposed from 11 p.m. on Tuesday the 25th till 4 a.m. on Friday the 28th of this month. The head of the Operational Centre for the Prevention of COVID-19 Outbreak and Army Commander also says that those who are engaged in essential services will be allowed to travel during the periods of travel restrictions as in earlier instances. The travel restriction, which has been implemented continuously throughout the island for several days, was lifted at 4 o'clock this morning. However, the travel ban between the provinces will be effective till the 31st of this month. Meanwhile, 70 more Grama Seva divisions in 10 districts have been isolated with effect from 6 a.m. today. It was on the 13th of this month that all island travel restrictions have been imposed with the aim of controlling the spread of the corona pandemic. Even though the travel restrictions have been withdrawn temporarily, the residents are permitted to leave their homes based on the final digit of their national identity card. 262 persons who have violated travel restrictions in the past 24 hours have been taken into custody. So far, 9,850 persons have been arrested regarding the offence of violating travel restrictions. The security divisions have been engaged in instant search operations by erecting roadblocks in different parts of the island today as well. The aim was to inquire whether people were leaving their homes according to the final digit of their national identity card numbers. The Department of Railways has taken measures to conduct daily 51 train journeys on behalf of the passengers who leave for jobs with lifting of the travel restrictions. Despite the imposition of interprovincial travel restrictions, 5 train journeys are being conducted on behalf of people travelling between provinces to engage in essential services. The Engine Drivers Association says that certain groups were engaged in propagating false information regarding a train strike today. The association adds that several train operations were compelled to be cancelled today due to engine drivers and guards taking part in vaccination sessions. The Sri Lanka Transport Board has deployed 3,000 buses for service throughout the island with effect from today. However, interprovincial bus transport is being restricted only for employees in the state and private sectors who are engaged in essential services.
The Chief Epidemiologist Dr. Siddharth Samravira stated today that the implementation of the disease control activities are being carried out at district level as well as in a grassroots level in the field. He also added that efforts have been taken thoroughly to curb the fast-spreading virus as health officials across the country are working tirelessly.
The disease control activities at the Ministry of Health, the focal point is the Epidemiology Unit. The responsibility of the Epidemiology Unit is surveillance of all the communicable diseases and identify the threats of diseases and then guide the district teams for the control or guiding the policy matters for ministry and the government. The implementation of disease control activities are being carried out at district level and much lower levels in the field. Each province there is a provincial director of health services. Provincial director of health services as the administrator, and there will be consultant community physicians to guide the province. At the district level, there are region director of health services as the administrator and consultant community physician to implement the disease control activities in the district. In each district, the regional epidemiologist with whom that we liaise for the district level activities, that who is responsible for implementing disease control activities in their districts. Much lower level, the district is divided into medical office of health areas. Each medical office of health area is divided into public health inspector areas. In each area, one PHI is responsible for the activities. Each MOH area, the medical office of health, is responsible for disease control activities. All these COVID-19 control activities are carried out through this mechanism. You should keep in mind that these people are doing this for last 1.5 years. This is in addition to that, their routine work. There are a lot of routine work that they have to do, including maternal and child health, immunization program, control of other communicable diseases, environmental sanitation. Our district teams and our medical office of health or the public health teams are working tirelessly for this activity.
Meanwhile, the Family Health Director, Dr. Chitramali De Silva, says that COVID-19 virus is not contracted through breastfeeding. Therefore, mothers who are COVID-infected are able to breastfeed without any health complications. She also stated that discussions are ongoing regarding the possibility of vaccinating the pregnant mothers.
During the recent past, we have seen there's a slight increase of pregnant mothers who are infected with COVID-19 infection. If a pregnant mother gets the infection, there is a possibility that they will develop complications, and also they might go on to preterm labor. Also, there may be more complications occurring among the pregnant women. So therefore, we have to protect the pregnant mothers getting the infection. Have to get a testing done and also get admitted to the hospital as early as possible compared to the non-pregnant population. Because you are at a high risk of developing complications, you have to be very cautious about your health. We have seen many mothers have delivered their babies. Mothers who are with COVID infection have delivered their babies successfully. Only 4 maternal deaths are reported so far. Once the baby is delivered, there is no issue of giving breast milk to the baby, even if you are having the COVID infection. The mother has to be very careful about the personal protective measures, to always wear a surgical mask and not to associate with the baby too much, but you can continue breastfeeding the baby. WHO and UNICEF evidence says that disease is not contracted through breastfeeding. So therefore, all the mothers who are COVID infected can breastfeed without any problem. So we are also now in the process of discussing with the professional bodies and also with the ministry officials to see the possibility of vaccinating our pregnant women. WHO and UNICEF, all evidence says there is no harm of breastfeeding the baby after getting the COVID vaccination, and also any postpartum mother or mother after a delivery can get the vaccine and continue breastfeeding for their babies. It's not a contraindication for breastfeeding.
Meanwhile, the Epidemiology Unit says the inoculation of the second dose of the COVID Shield vaccine and the first dose of the Sinopharm vaccine under the COVID-19 immunization program is being carried out continuously. 28,309 persons have been vaccinated yesterday. The second dose of the COVID Shield vaccine has been given to 1,612 persons yesterday. Accordingly, the total number of persons inoculated with the second dose of the vaccine has reached 267,077. The first dose of the Sinopharm vaccine has also been provided to 26,697 persons yesterday. Accordingly, a total number of 375,316 persons have been inoculated through both vaccines. The Sinopharm vaccine has been delivered to bhikkhus and bhikkhunis in the Horana Shasanakarana Balama Mandalaya at the Moragahena Viharasthana in Horana today. Another Sinopharm vaccine inoculation program has been conducted at the International Buddhist Center in Kadawatha today, where more than 1,000 persons have been inoculated. Provision of the Sinopharm vaccine to the government officials engaged in duties in the areas of Paduka Medical Officer of Health Division is taking place at the Sri Maviharasthana in Paduka. Another inoculation program has been conducted in Reimposed yesterday under the direction of the Sri Lanka Army. People in Artigala in Hangwella have been vaccinated with the Sinopharm vaccine at Artigala Junior School today. A Sinopharm inoculation program has been conducted at the Campbell Grounds in Baralla. Residents of Colombo 1 to 15 have reserved a date and time for vaccination via internet have been inoculated. People in the Grama divisions of Halloluwa, Kalegedara, Paranavahandiya and Kuligedara in Divulapitiya Divisional Secretariat Division have also received the COVID immunization vaccine today. State Minister Indika Anuruddha has monitored the procedure. Sinopharm vaccine has been given to employees of the Sri Dalada Maligawa in Kandy and the Kandy General Hospital today. The Sinopharm vaccine has also been delivered to residents in the Mahabagi Grama division in Vattala today. A further 1,579 COVID-19 patients were detected today. 1,307 fully recovered patients have left the hospitals today. Accordingly, the total recoveries in the country has increased up to 119,629. A total of 23,734 COVID-19 patients are still receiving treatments in hospital. 29 COVID-19 related deaths have been reported yesterday. The victims have been reported from Imaduwa, Murutugahamula, Anuradhapura, Moratuwa, Meerigama, Ingiriya, Bulatsingala, Nebada, Batulla, Galioya, Jaffna, Handapangoda, Habaraduwa, Emilipitiya, Gaul, Kadawatha, Halleliya, Mahayawa and Kalathura South. A decision has been taken to direct corona-infected persons to their nearest treatment centres. The decision in connection was taken at a meeting of the COVID-19 Special Action Task Force Committee today. Minister of Health Pavitra Vanyarachi has presided over a meeting of the Task Force Committee this morning. State Minister Dr. Sudarshini Fernandopulle and senior officials in the health sector were also present at the meeting. It has been pointed out at the meeting that the COVID patients as well as their family members are being subjected to severe mental burdens as a result of the patients not being directed to the nearest treatment centres. Therefore, the decision has been taken to bring the patients to the nearest treatment centres. The Health Promotion Bureau reiterates that it is essential for the people staying in camps of the displaced due to conditions such as floods and earth slips to always strictly follow health guidelines in order to protect them from the coronavirus. The Department of Government Information says that the validity of the media identity cards issued to media persons for the year 2020 has been extended until further notice. It has been identified that 14 persons were afflicted with the COVID-19 disease as a result of the random PCR test conducted on persons engaging in businesses in Yatyantora town. The Health Division says that as a result, measures have been taken to temporarily close down around 10 shops in the area. Steps have also been taken to temporarily close down the Hatton Post Office due to the detection of 2 COVID-19 afflicted employees in the office. 17 employees of the post office have been subjected to self-quarantine. The daily activities of the post office is being conducted at Tepal Piazza in Hatton town. Businessman Gamini Mahanama has donated a 49-room hotel owned by him in Maharagama to be used as COVID-19 intermediate treatment centre. It was handed over to Dr. Bandula Gunawardana, who has officially presented it to the health divisions. Polonnaruwa District Parliamentarian Amarakirti Attukorala presided over an event to hand over the necessary equipment for the treatment of the COVID-19 patients at Hingurakakoda Base Hospital. The Metrics private company has come forward to fulfill the increasing oxygen requirements of COVID-infected patients. Meanwhile, 7 beds were provided of ICU of the Gampa District Hospital today. They have been donated by a group of advanced level students of 1990 in the Gampa area.
The target of the project on 10,000 beds within 10 days for the COVID patients has been fulfilled yesterday. Minister Namal Rajapaksa has taken the initiative in the program. The minister has requested the youth of the country who are being motivated by humane qualities to continuously maintain this noble initiative despite the fulfillment of this preliminary aim. The National Youth Services Council and the National Youth Brigade have taken the forefront in realizing the objectives of the project. State institutions and numerous voluntary organizations have extended extensive cooperation in the program. The 10,000 beds in 10 days program has got underway on the 7th of this month. A special feature of the program has been to manufacture 6,000 beds in excess by overtaking the anticipated target. Some have questioned whether preparing of beds is a remedy for the treatment of coronavirus. The youth of the country have joined the program voluntarily, disregarding political party differences. As a result, many youth were engaged in preparing activities in the hospitals as well. Donation of equipment and material, including 200 beds to COVID treatment center at the Kidulgala Regional Hospital, has taken place yesterday. The event has been organized through collaboration of the collective of trade unions affiliated to the Sri Lanka Potujana Perumana at the Sri Lanka Ports Authority. The value of the contribution has exceeded 4 million rupees. State Minister Kanaka Herath has also participated on the occasion. The Vavuniya Intermediate COVID Treatment Centre, constructed by the Vani Defence Forces headquarters, was handed over to Vavuniya District Secretary Saman Bandulasena. The centre, with facilities to treat 250 COVID-19 patients at once, is located in Tekkavatta in Vavuniya. Commander-in-Chief of Vani Defence Forces Major General D.M.H.D. Bandara and other officials were present at the ceremony. A special ward complex with 100 beds for COVID-19 patients is also being constructed at the Rikilagaskad Pradesha Sabha grounds. The beds have been produced by the Nuwara District Youth Brigade. A group including Chairman of the Nuwara District Development Committee Parliamentarian S.B. Disanayaka were also present at the occasion.
Now, new cases continue to decrease in India after recording more than 281,000 COVID-19 cases in the last 24 hours, while after 4,100 COVID-related deaths were reported across the country. Meanwhile, in a village in northern India engulfed by COVID-19, village practitioners of alternative medicine have set up an open-air clinic where they distribute glucose and other remedies to patients with symptoms of COVID-19.
There are cows grazing everywhere. The sick are laying under a tree and their glucose strips are hanging from the branches. This is a village in northern India that's been engulfed by COVID-19. There's no doctor or medical facility in Mavalagopagar in the state of Uttar Pradesh. The closest hospital has no beds and the villagers can't afford private care. So instead, villagers who practice a form of alternative medicine have set up an open-air clinic where they distribute their own remedies. The tree is an example. It's called a neem tree, which does have some uses in medicine. The villagers hope that by sitting underneath it, it will raise their oxygen levels. But there's no scientific basis for this belief. Rajendra Singh's father is believed to have died of COVID-19.
People have no option but to go to quack doctors. This is leading to deaths in the village. When a proper doctor won't have a look at the patient, where else will they go? There is no scope for getting oxygen, such is the situation. When patients get out of breath, they go to the trees to improve their oxygen levels.
The country's devastating second wave of infections continues to bring hospitals in big cities to breaking point. And rural areas are faring even worse as healthcare facilities are threadbare there. In this village, people are just making do as best they can.
New members have been appointed to the Hindu Cultural Fund. Prime Minister Mahinda Rajapaksa has participated in the event held in this connection at the Temple Trees today. The Hindu Cultural Fund has been established with the objective of the promotion of Hindu religious and cultural activities under the Parliamentary Act of 1985 No. 31. Secretary to the Ministry of Buddha Sasana, Religious and Cultural Affairs, Professor Kapila Gunawardana, has been appointed as the President of the Fund. The Hindu Cultural Fund is comprised of an 8-member board of governors, including the President of the Fund. Director of the Department of Cultural Affairs A. Uma Maheshwaran and Additional Director K. Hemalojini have been officially appointed to the fund. The other members of the fund are former Secretary to the State Ministry of Rehabilitation Shanti Naukasan, Chairman of Board of Trustees of the Mayurapati Sri Bhadrakali Amman Devalayam P. Sundaralingam, Secretary to the Board of Trustees of the Jintupiti Sri Siva Subramaniam Swami Devalayam G.V. Siva Subramaniam, Duresami Vigneswaran and A.B. Jayaraj. All the appointments have been made by the Prime Minister.
Prime Minister Mahinda Rajapaksa says that it is more appropriate. Prime Minister Mahinda Rajapaksa says that it is more appropriate for both Palestinians and Israelis to show restraint and de-escalate tensions and commence negotiations for a ceasefire. The Prime Minister, issuing a statement on the latest outbreak of hostilities within the Israel-Palestinian region, says that he was deeply grieved over the present conflict situation. The Prime Minister further says that as the founder president of the Sri Lanka Committee for Solidarity with Palestine, that he has held the position of Palestinian people's legitimate right to statehood must be upheld. The Prime Minister's communique further says that Sri Lanka stands by its position that it is only by the peoples of Israel and Palestine should resolve their differences through negotiations for a sustainable peace.
The Kingdom of Norway celebrates its Constitution Day today. The day is a national day in Norway with parades and celebrations to commemorate the signing of the national constitution on May 17, 1814. Norwegian ambassador to Sri Lanka, Trine Eskadal, in an exclusive interview with the national television, shared her thoughts on the extensive and robust bilateral ties and cooperation between the nations, and also spoke about the National Day celebrations in Norway.
The Constitution Day is it's actually our national day, and it's the biggest celebration we have during 1 year. So historically, it's to celebrate the signing of our Constitution in 1814. After 400 years of union with Denmark, we declared ourselves an independent kingdom. We still had to wait to 1905 before we were completely independent from Sweden. But ever since, we have been celebrating this day, both to appreciate our constitution and the values it holds, but it's also a big celebration of the children. So we have the children's parades all over the country, in townships and villages, and of course in the capital. The children, they parade in front of the parliament and in front of the royal castle, and we have the marching bands and people dressed in their national costumes. They wear the ribbons with the blue, white and red. It's a big celebration, and all the schools in the afternoon, they have games for the children. They eat hot dogs and ice creams and loads of candies, and it's like you gather with family and friends, and everybody's just very happy.
Let's go into the serious side of our friendship with Sri Lanka and Norway. How do you perceive the success of the bilateral friendship that we have with Norway and Sri Lanka?
Norway and Sri Lanka have enjoyed, diplomatic relations for over 70 years now. Last year we celebrated our 70 years of diplomatic relations, and I think it's a proof of, good relations, solid relations, robust relations. Today we see that our relations are based on very many shared values, very many common interests. We are both, work together in the multilateral organizations such as the UN. We both support international collaboration and international humanitarian or international laws, and also the human rights laws. So we see that together we share very many things that we are able to collaborate on, both internationally and of course also here in Sri Lanka.
Catch National Television's exclusive interview with Norwegian Ambassador to Sri Lanka, Trine Eskadal, after tonight's bulletin on ChannelEye.
In other stories, the Supreme Court verdict on the draft bill of the Colombo Port City Economic Commission is scheduled to be presented to Parliament tomorrow by Speaker Mahinda Epidemiology. The Committee on Parliamentary Affairs has decided to conduct two-day debate in this regard on the 19th and 20th of this month. Several groups have submitted petitions in the Supreme Court against the draft bill on Colombo Port City Economic Commission after it was presented to Parliament. A 5-member panel of judges headed by the Chief Justice has delivered the decision on the Supreme Court to the Speaker recently upon a lengthy examination of the issue. Accordingly, the Speaker is scheduled to declare the Supreme Court verdict when the Parliament resumes sittings at 10 o'clock tomorrow morning. It has also been disclosed at a recent meeting of the Parliamentary Committee on the State Finances that the Sri Lanka Board of Investment is preparing to engage in the maiden investment at the Colombo port city. Chairman of the committee, parliamentarian Anurapia Darshanayapa, said that the initial project of the Colombo port city, with an investment of $100 billion is scheduled to be implemented under 2 stages. The government and the opposition people's representatives of the Committee of the Government Finances were present at the meeting.
Selection of winners of the quiz program conducted during the telecast of the Guru Gedara educational program via ChannelEye of the Sri Lanka Rupavahini Corporation has taken place recently. The event took place at the studio complex of the National Education Institute. State Minister of Educational Reforms, Open Universities and Distance Education Promotion, Susil Premachandh, has also participated in the program to select the winners. The main objective of organizing the competition has been to uplift the status of the Guru Gedara educational program. The Bank of Ceylon is the sponsor of the program. Valuable presents are scheduled to be handed over to the winning students of the competition. The Guru Gedara education program has been implemented with the objective of not allowing to destabilize the education of children amidst the corona pandemic. Head of the Guru Gedara educational program of the National Television, Chandana Senviratna, promotional officer of the Bank of Ceylon, Tharindu Vanika Surya, and Deputy Director General of the National Education Institute, Ranjit Padmasiri, have also attended the event.
The World Telecommunications and Information Day falls today. The theme of this year is speeding up of digital transformation in a time of challenge. The day is being commemorated over the establishment of the International Communication Union and the International Telegraph Agreement signed in the year 1865. President Gotabaya Rajapaksa, issuing a message in connection with the World Telecommunications and Information Day, says that the need to use communication technology to every section in the society has been to intensify due to the COVID-19 pandemic. The President in his message has also reiterated the need to minimize inequalities prevailing in the digital world. He has requested the member states to intervene in this process. Prime Minister Mahinda Rajapaksa, issuing a message in connection with the World Telecommunications and Information Day, points out the need to enhance infrastructure facilities pertaining to communication technology at a time when the entire world community is being affected by the pandemic. The Prime Minister further recalls that the Sri Lanka Telecommunication Regulatory Commission is engaged in the Communication to Village program with the objective of providing 4G connections to the entire country.
And that's it for tonight's news. Watch us tomorrow at the very same time. Good night.